Cannabis or marijuana, or commonly known by its street name weed, is a drug that comes along with many issues. According to the National Institute on Drug Issues, marijuana is the most commonly used illicit substance, especially among young teenagers beginning from the age of 12. Okay, so who exactly does this affect? Well, teenagers themselves in form of their physical well-being, the families who have to pay for this, therefore having a negative impact on their economic situation. This then leads to fracture between family members, leading to arguments and even divorce, which does have a negative impact on the psychological well-being of the entire family. This then leads me to the social effects of marijuana. See, marijuana has very many negative social effects, which include attention, memory, and learning, which can last for up to a week depending on how much they took, which therefore has poor educational outcomes or are even less likely to graduate out of high school. This doesn't stop there, no, because it goes on to later dependence on the drug at later life, which could have impacts on their income and even lead to unemployment, criminal behavior, and lower life satisfaction. Another question that rises up is what is it that causes the teenagers to take this drug? First of all, curiosity, and second of all, peer pressure or the need of wanting to fit in with a group, which does link back to the social effects of marijuana and brings me to the environmental reasons why these teenagers would want to use drugs or be forced to do so. First of all, living with family members who take drugs could become a habit for the teenagers and coming from broken families, and that is the only way they can release the stress. How can we reduce the usage of the drug? Well, there's three ways. First of all, they could eat the drug other than smoking it. Second of all, they could have less of the drug. And third, we can look at the Ottawa Charter action areas and figure out what is it that needs to be done. First of all, by creating supportive environments. First, we could have parents to listen to their children's issues, which can go a great way. According to Lockhart 2010, we need to take care of each other, our communities, and our environments. Secondly, we need to provide self help materials like flyers and brochures, and even free help like the Kids Helpline. According to the ABC, this could decrease the usage rate and even help quit the drug altogether. Secondly, strengthening community action. This could be done by first creating support groups for the addicts. And according to the UKCIA, these addicts tend to feel extreme paranoia or even unwanted in the community, and these groups could be a great help. Secondly, having ex cannabis users talk to them can help them look at the drug at a different perspective and could even lead to them quitting. Quit Victoria says that showing you care and sharing your experiences could go a great way. The third thing that we could do is develop their personal skills. This could be done simply by having programs in school where they can learn the effects of marijuana. The World Health Organization says this looking at this text from the World Health Organization website. Secondly, encouraging the teenagers to talk about their issues and the roots of the issue of the use of the drugs. School drug education says, and I quote, "We need to talk and let them realize the implications which could decrease their usage rate." We also need to reorient health services. This could be done by first of all increasing the availability of professionals for them to talk to, like chaplains. The state government of Victoria says that teens respond well when listened to. Secondly, healthcare facilities and services could be increased by, first of all, having several services in one location or having them in several areas, which could increase the availability for the individual. Last but not least, building healthy public policy. First of all, laws against teenagers need to be reinforced and made stricter. because according to the National Cannabis Protection Information and Quitting, this could lead. This states that this article shows exactly that it's very little to up to four, 50 cent $50 that they need to pay. Another thing that they need to do is that the parents that condone this need to be charged against simply because it is a criminal offense to supply drugs to young people or minors. Thank you.